Okay, so in today's lecture, we discussed about, okay, in the fourth unit we have hemostasis, clotting factors, clotting mechanism, right? So in last lecture we discussed about hemostasis. In order to understand hemostasis, we need to know three important ground knowledge. That includes properties of platelets. What are the three properties of platelets? Adhesion, aggregation and agglutination. And what are the phases of hemostasis? Vasoconstriction, platelet blood formation and clotting of blood. And what are the three properties of blood vessels? Two properties, vasoconstriction and vasodilation. Vasoconstriction happens because of release of serotonin. Serotonin will in turn causes sympathetic nerve to vasoconstrict, resulting in reduced blood flow, results in reduced bleeding at the site of bleeding. Okay. Then coming to the hemostasis. Hemostasis starts with a blood cut. So whenever there is a blood vessel cut, the subendothelial collagen will get exposed. Now the endothelial cells will secrete 1 milligram factor, and 1 milligram factor will get deposited on the surface of exposed collagen fibers. Now a roaming platelet will get recognized and attached to the surface of 1 milligram factor, and that is called the first property of platelet. What is it? Adhesion. So a platelet adheres to the 1 milligram factor by a receptor called 2B1A, glycoprotein 1A, okay, GP1A. Now this attached platelet will release three important chemicals. One is ADP, chromaxin A2 and platelet activating factor. Now these three together will cause the other platelets to aggregate at the site of bleeding, hence resulting in second stage of platelet, which is the aggregation of platelets. Now upon the aggregation of platelets, they will make primary plug formation. This will temporarily prevent the bleeding. Upon primary plug formation, now these activated platelets will convert fibrinogen into fibrin. Okay. Now this fibrin will cause the fibrin threads, and fibrin threads will clot the blood. So this is all about the homeostasis. Then we discussed about clotting factors. Clotting mechanism. In clotting mechanism, you need to know three basic things. One is we have 13 clotting factors involvement. Then second one, they will go in a enzymatic cascade reactions, where one inactive enzyme will get activated and active form will convert other inactive clotting factor into the active clotting factor. Okay. So usually a clotting mechanism has three important stages: a prothrombin formation of prothrombin activator, then a conversion of prothrombin into thrombin, and third stage is conversion of fibrinogen into fibrin. Now prothrombin activator can achieve via two pathways: extrinsic pathway and intrinsic pathway. So intrinsic pathway is a long pathway, whereas extrinsic pathway is shorter pathway. In order to understand this pathway, first we need to have the basic idea on clotting factors. So we have totally 13 clotting factors. And what are the 13 clotting factors? Starting with fibrinogen, low thrombin, tissue thromboplastin, calcium, labile. There is no factor. 6 factor is nothing. 7 stable factor. 8 anti-hemophilic factor. 9 Christmas factor. 9 Stewart-Trevor factor. 11 plasma chromoplastin antecedent. Hegman factor and 5 fibrin stabilizing factor. Then, in order to understand this mechanism, I have given you a mnemonic which is taken from a YouTuber, Adalik Adesini. So the idea is you need to know that from 12 to 1, okay, and 10 is in the center. So 12, 11, 9, 10, 2, 1, 7. Okay. Then in between 11 and 9 we have 8th factor, and in between 9 and 10 we have 5th factor. If you remember this mnemonic, then you can easily able to memorize the entire mechanism of clotting. Now in the center in this mnemonic, you can see 7, 10, 9 and 2. Whereas I given a mnemonic called 1972, 10, 9, 7, 2. These four clotting factors are extensively dependent on vitamin K. So absence of vitamin K will result in inactivation of these clotting factors. Inactivation of these clotting factors results in absence of clotting, no clotting in the no clotting of blood. Okay, so that is why these are vitamin K dependent factors. Now, in patients who has excessive clotting, for that patients we will keep the patient in warfarin therapy. Warfarin will act as a anti-vitamin K antagonist. It will suppress the vitamin K activity so that these clotting factors cannot get activated, and further clotting of blood cannot happen in a patient who has ischemic heart attack or intravascular coagulations. Okay, so this is all about the clotting pathway. Then that's it. So a quick A quick revision. What is the fourth clotting factor? 12th clotting factor? 12th. 9th. SMAS factor. 10th. Then 4th. What is the meaning of chelation? Chelation, anticoagulants. Removal of calcium is called chelation. If you remove calcium, your blood can't clot. Okay? Deficiency of any clotting factor results in increased clotting time or bleeding time. Clotting time. Deficiency of clotting factors results in increased clotting time. And absence or less number of platelets will result in increased bleeding time. Okay? So this is all about hemostasis and clotting time. If you have any doubts, no doubts, right? So thank you very much. No, just okay. So thank you very much, class. Thank you very much.